patients who are exposed to environmental toxins or medications interfering with the central nervous system frequently develop motor complications. And among the motor manifestations that these patients might experience as a consequence to the exposure of these drugs or to toxins are involuntary movements. Now, when we speak about hyperkinetic movements, we understand a number of motor manifestations. The most common one is chorea, or presence of tremor, but we also include less common involuntary movements like ballism or myoclonus, or quite commonly as well also dystonia. So there are basically 5 different hyperkinetic movements that can occur as a consequence to toxin or drug exposure when they interfere with the brain, particularly with the function of the basal ganglia. The mechanism leading to the development of hyperkinetic movement is generally an excessive facilitation of movement due to reduced indirect pathway and too much overactivity of the direct pathway in the central nervous system, which leads to overactivation of several muscular districts. During my talk, I will highlight particularly the consequences of exposure to metals, and metal accumulation in the brain can occur as a consequence of genetic defects, or like in the case of iron or copper in Wilson disease, but also as a consequence of more internal medicine disturbances or liver failure. And I will show cases of manganese accumulation in the brain as a consequence of hepatocellular degeneration in people who later underwent a liver transplant. Another condition that can lead to metal accumulation in the brain might be the exposure to drugs, environmental or recreational drugs. I refer particularly to a number of cases that became developed involuntary movements, particularly dystonia, as a consequence to exposure to recreational drugs in Eastern Europe. So these people were drug addicts who injected themselves with tablets containing ephedrone, which is, in a small amount used generally to treat migraine. But if you take a lot of tablets, can give a bit of a feeling of euphoria, or by increasing blood flow in the brain. Now, unfortunately, these tablets are not supposed to be injected because the excipient that they use in the manufacturing of the tablet contains manganese. And so if you crash a lot of tablets to get a bit of a high through the injection of the active drug, you concomitantly inject yourself with high concentration of manganese, and the manganese reaches the brain and it damages the basal ganglia, particularly the globus pallidus, where it creates a condition leading to development of dystonia. So this dystonia induced by excessive manganese exposure through recreational drugs containing ephedrone, injected artificially by drug addict in Eastern Europe, has created a class of individuals who, even after interrupting the usage of this products, remained with a movement disorder, dystonia, for a long time, and had to be, in some cases, treated with deep brain stimulation. Another group of conditions that could lead to the development of involuntary movements are degenerative disorders of the basal ganglia. And this includes mitochondrial dysfunction, where you may have hyperkinetic movements developing as a consequence of degeneration of the striatum. This is sometimes seen in children. And these children might develop postural deformities and dystonia. Or you could have this also in adult people occurring in cases of direct viral damage of the brain. We have had in my region in Northeast Italy a couple of years ago several cases of West Nile infection, and the West Nile virus has a specific neurotrophism which leads to damage of the basal ganglia. And we had cases developing dystonia and Parkinsonism and tremor as a consequence of the direct basal ganglia damage. So overall, during my talk, I will provide a highlight of the hyperkinetic movements that can occur as a consequences of metal accumulation, which are toxins to the brain, iron, copper, or manganese, or use of recreational drugs, which may also lead to the accumulation of specific metals in the brain, like in the case of addicts using manganese, or a viral infection leading to specific basal ganglia damage, like in the case of West Nile, where you might see dystonia and Parkinsonism developing as a kind of consequence of brain penetration from the virus.